So now we're going to give you an introduction to some physical disabilities of people that we might work with. So objectives for this section, at the end you will have an understanding of muscle tone, meaning what's normal muscle tone, high muscle tone, and low muscle tone. You'll be able to know what they look like and how it affects people. We're going to talk about the definition of range of motion and contractures. We'll talk about the difference between tone and intentional behavior, the basics of osteoporosis, and the basics of skin breakdown. All right, so first we're going to talk about muscle tone. What you or I have is typical or normal muscle tone. A lot of people that we work with might have high muscle tone, and that means that their muscles are a little bit stiffer and it's a little more difficult for them to move. We also might work with people who have low muscle tone, for lack of a better term, it's like floppy. So that means that they might have a little bit more difficulty moving or a little bit decreased strength, which affects their mobility. So just know that people that we work with, they have abnormal muscle tone, and so things are out of their control. They're not being resistive or lazy, it's just sometimes they're not able to do things the same way that you or I would be able to.
So range of motion is the amount of movement that happens at any certain joint. So my shoulder has 180 degrees of range of motion. So I can move my shoulder from here to here. There's no restrictions. Where some people that we support may have decreased range of motion, sometimes due to their high level or low level of tone. To address these range of motion impairments, they might have PT or OT to increase strength, thus increasing this range of motion. Where it's important for you guys is to encourage range of motion and independence in all activities that people that we support do throughout the day. So that includes putting away dishes, maybe doing laundry, eating. It's probably one of the more difficult things for you guys to deal with as DSPs, is to watch someone struggle to complete something such as feeding themselves, but that might be the only movement that they have, is bringing their utensil from here to here. And if you're doing that for them, then that's really eliminating any independence that they have throughout their day. So it's really important that we encourage independence, and there's certain techniques such as hand over hand that we can assist in these movements without doing things for them. Benefits of range of motion are increased comfort and flexibility, increased circulation and nutrition to the joints, maintenance of activities of daily living such as dressing and bathing, greater ease for you as staff to perform skin and hygiene care. If someone has reduced range of motion, it might be really difficult to get into those crevices, or maybe if their arm is flexed, getting into the elbow crease or underneath the armpit to do that hygiene stuff. And if we're not in there able to clean properly, that's going to lead to some other issues such as skin breakdown. A good analogy for the anatomy of a muscle is a rope. If you think of a rope comprised of many little fibers to make one strong structure, it's kind of the same for a muscle. A muscle is comprised of many different fibers and spindles that make a strong structure to move your joints. So if, for example, if you think about your bicep, it shortens or contracts when I bend my elbow, and it lengthens when I straighten my elbow. So those fibers, when they shorten, are overlapping, and then when I straighten my elbow, they're stretching out. When a contracture develops, those muscles are typically in a shortened position, so when they're overlapped, and it's over a longer period of time without movement in the opposite direction. And when that happens, the muscle physiologically changes and stays in that shortened position. And once that happens, there's really no resolve besides surgery.
So it's really important that we are all working together to help people maintain their range of motion and their mobility to help prevent contractures. So like Tony said, staff are going to work with people to encourage them to do what they can and to support them with their activities of daily living to maintain their mobility. And also PT and OT might work with a person on stretching. So that's where we take the joint to its end range of motion to work on addressing any limitations. So those things working together will help us to prevent what's called a contracture. So a contracture is a permanent loss of movement at a joint. It's usually caused by high muscle tone or a lack of movement. So if someone has high muscle tone, say in their bicep, and their elbow is held in this position, and they don't receive stretching from therapy or encouragement and assistance from staff to move that elbow within their available range, then eventually the muscle itself can shorten. So there's actually a physiological change and you're not able to get that range of motion back. The only way to address that would be with surgery, which is something that we really want to avoid. All right, so in summary, we just want to emphasize that there's a difference between range of motion and stretching. So only PT and OT provide stretching. That's when you're actually physically putting your hands on someone and stretching that joint to its end range. You as staff are not going to be doing that. The way that you encourage maintaining range of motion is by assisting people to do what they're able to do on their own and encouraging independence in their day-to-day life to maintain their overall mobility. So it's a shared responsibility of clinical staff and direct care staff to prevent and slow down the formation of contractures and resulting loss of range of motion. We just want to give you an example of how you might support someone who has higher muscle tone and decreased mobility. In this case, it's Tony's right arm. He has high muscle tone and it's held in this position. However, he does have some ability to straighten it out. So you want to encourage him to do what he's able to do to maintain that mobility. So we'll demonstrate by having him pick up this mug here. So as a staff, you're never pulling on someone's arm, right? You are just supporting them, providing them hand over hand and assisting as needed. So if Tony's reaching for this mug here, you're supporting at the joint. He might need a little help to lean and then maybe a little help to extend his fingers and get the object fully in his hand. But from that point, he is able to do most of this on his own afterwards. So by you providing that support and that assistance, you're maintaining the mobility that he has of this joint, right? You're not just having him stay here in this position, because if you were to do that and you weren't giving him opportunities for movement, that's how that contracture develops, and that's how that arm would get stuck in that position, which is what we want to try to avoid. So we'll talk about osteoporosis. It is the loss of bone mass or density. Risk factors include non-weight bearing status, so people who are not standing or walking. That would be people who sit in wheelchairs for most of their day. Some medications, including seizure meds, can cause osteoporosis, and that's really common in people that we support. A lot of them are on seizure medications. Nutritional and hormonal status can play a role, like postmenopausal females are more likely to have osteoporosis due to the hormonal changes that they experience, and a lack of exposure to sunlight goes hand in hand with decreased vitamin D. So that can cause osteoporosis as well as age. Just sometimes naturally our bones can lose density as we get older. And I want to circle back to the non-weight bearing status. So our bones respond to the forces that we put through them. So when we're standing and when we're walking, our muscles are contracting and gravity is pushing down on our bones, and that cues us to stay strong and to maintain the mass of your bones. If you're not getting that input, naturally your bones will start to lose their density and start to break down because they're not being told that they have to stay strong. So that's why standing and weight bearing, when it's approved in someone's plan, is so important, and that's why we want to maintain their ability to stand for as long as possible. So osteoporosis, just knowing if people have this diagnosis is very important. With anyone that you work with, you want to make sure that you're moving people slowly and smoothly, but it's especially important with people who have osteoporosis because they are more fragile and they're more at risk for injury. You want to support their limbs above and below joints. We're never pulling on arms or legs. Really, the best place to move people is by supporting at their shoulders and their trunk, or using a piece of mechanical equipment. And you always want to encourage weight bearing when it's approved in the person's care plan. So like I said, you want to give their bones that input to stay strong. So the next thing we're going to talk about is skin breakdown. It's also called decubiti, ulcers, pressure sores, or bed sores. The definition of That is a localized area of red or open skin. It's usually in areas of high pressure over bony areas most commonly. Skin breakdown can happen anywhere where there's too much pressure on one area for too long. Naturally, the tissues will start to break down on the inside because they're not getting blood flow. So considering the risk of skin breakdown is especially important with people who use tilt and space wheelchairs, because that means that they are not able to move around on their own. So if you think about, like you or I, how often we shift around in a chair, we're constantly changing position to make sure that we're comfortable, but someone who uses a tilt and space wheelchair isn't able to do that. So they're really dependent on staff to provide them with different positions to help prevent skin breakdown. Some risk factors for skin breakdown are it being over a bony area of the body. Examples of that are like your elbow, your heels, your knees touching, really anywhere where there's not a lot of soft tissue because the tissue there is more fragile. Prolonged pressure is a risk factor, and fragile skin. So not only can skin breakdown happen from pressure, but it can also happen from friction. So you can get skin tears. So that's why fragile skin is more at risk for becoming an open area. Decreased circulation is a factor. If you're not getting circulation to the area, the tissue is not getting the necessary blood flow that it needs and the necessary nutrition. Also, people's diet can play a role in this. Friction and shearing, like I talked about, that can cause your skin tears, so you want to make sure you're never pulling people's clothing aggressively against their skin or any of the gait belts or slings that we use. You always want to make sure that you are being careful when you're applying those things. Moisture and heat also can affect your skin and cause breakdown. If there's too much moisture and heat in one area, you can start to get something called maceration. You can get infections and the skin becomes damp and starts to break down that way. So incontinence kind of goes hand in hand with that. If someone is sitting in an attends that is soiled, then they are more likely to experience skin breakdown because of that moisture and heat. There's also a lot of bacteria, so that's just a recipe for disaster. Human error can cause skin breakdown. So dragging or pulling people to move them, that causes friction, that can cause open areas of skin. Wheelchair seat cushions being in backwards or upside down is huge. You want to make sure that someone's wheelchair cushion is on their seat the correct way so that their bottom is sitting on the correct part of the cushion and they're not getting pressure on areas where there shouldn't be. Same thing with shoes being on the wrong feet or braces being on the wrong feet. That can cause pressure on areas and can cause skin breakdown that way. So why is this important? Skin breakdown is very painful if the person is able to feel it, especially. There's a lot of people that we work with who actually don't have the same sensation, so they can't tell that they're experiencing pain, and that actually makes them more at risk for skin breakdown. It's very preventable. And it can rapidly progress with devastating consequences. So it can start with just a red area of skin, and it can quickly progress to a big open area and can cause infections. So we really want to make sure we're being proactive to prevent these things. Best practice requires repositioning someone at least every 2 hours. We really should aim for repositioning much more frequently for people's comfort and quality of life. So you want to make sure that if someone uses a wheelchair, especially someone who uses a tilt and space wheelchair, that means that they are not able to reposition themselves. They require assistance from staff to do that. So you want to make sure you're getting them out of their wheelchair onto a different surface and just using lots of different positions to make sure you're not getting pressure on too much area for too long of a period of time. So ways to prevent skin breakdown are keeping skin clean and dry, changing positions at least every 2 hours, like I said, properly using support surfaces that relieve pressure. So that includes seat cushions and mattresses. And you want to make sure that clothing is not a risk factor. You want to avoid thick jeans or nylon pants. You want people to wear things that are breathable, especially if someone is not able to reposition on their own. A lot of times people will be wearing clothing all day and you can see the seams of their jeans. So really make sure that stuff is stretchy and breathable and comfortable for the person. You also want to make sure that appropriate protective footwear is on when they're in their wheelchair. So you don't want someone barefoot or wearing slippers when they're using a wheelchair. You need something with a firm bottom so that they're not getting injuries to their feet from their foot plates. So you want to make sure that you are monitoring the skin of people that you're working with. If you see any atypical redness, you want to notify your supervisor or RN, or also PT or OT might be contacted. So if you notice any changes with someone's skin, you want to make sure that you are notifying those people so we can make sure that it's not a pressure related injury and that we can make changes moving forward if necessary.